Grab your foam roller and come over to the wall. Bring your dominant knee down onto the roller, coming into a kneeling position. Same arm as the back leg will come up the wall for a pec minor stretch. Single arm cactus, twist away from this arm. Inhale laterally, pulling the navel in towards the spine and lifting in and up on the muscles that stop your stream of pee. Fog of mirror as you twist away from the arm. Again, inhale, belly button in, deep lift in and up on those pelvic floor muscles, and exhale, twisting away from the arm. Hear those exhales like you're fogging a mirror. Inhale laterally, belly button to spine, lift in and up on those muscles, contract, sustain the contraction, twisting. The front leg, make sure it creates a right angle and that front knee is tracking forward over the second and third metatarsals. Your back knee is pressing heavy into the roller so that all 5 metatarsals of the back foot are down. Breathe in, and on your next exhale, come up and let's switch sides. Setting up to open up the hip flexor and pec minor on the other side. As you're working here, use this wall as leverage. Use the foam roller to support the knee by pressing the knee down into it for stability. Let that front leg create a right angle, so make sure that the knee isn't tracking beyond the metatarsals. I want you to track it forward, deepening the lunge, but you don't want the knee way over the foot, so you may have to scoot the foot farther forward to keep your knee safe. Keep your head up on your spine. Watch out for the ribs spraying forward. Imagine hands on your shoulder blades and bring the chest back into those hands. Gaze eye level. Inhale laterally, belly button in, lift in and up on those muscles that stop your stream of pee, and fog a mirror as you twist away from that arm on the wall. Again, inhale, belly button in, lift in and up on those muscles that stop your stream of pee, and fog a mirror as you twist. From here, we're going to come up, we're going to learn our exercises on the trampoline at 50% effort. We'll begin in the transverse plane. This is the turning plane where 90% of injuries occur. We'll get it over with before we get fatigued. So you'll need your second to heaviest loop band around your thighs. This will stay around the thighs for the entire workout. And we'll also need our lightest Theraband. Hold it at the ends like you're holding a jump rope and wrap it around the knuckles with the thumbs on the outside. From here, you'll create 2 right angles. This is a serratus anterior retraction once you get those arms up into the 2 right angles, keeping the elbows as high as the shoulders. Make sure they don't droop and the wrists are flat. From here, soft bend in the knees. We're going to bounce for 4. And then we're going to shift to our dominant leg for 4. And then we'll turn for 4. We'll turn back for 4. Go back to 4 doubles. And then non-dominant leg for 4. Turning for 4. Turning back for 4, and back to 2 feet. So we're going to keep this pattern going, keeping a soft bend in the knees, feeling the outer edges of the feet working, making sure the legs stay hip distance apart. There's some pull out on that band. Never lock your knees. It's not about the height of your jump right now. It's about getting into the abductors, the outer thighs, the hamstrings, the glutes. So we need to stay low with a nice soft bend in the knees as we're working. So from here, this is our first exercise in the transverse plane, the turning plane. We're going to grab our second to heaviest Theraband now, setting this lightest Theraband to the side, bringing the second to heaviest Theraband behind the back, wrapping from the ends, creating what I call a serve the platter arm position. Imagine your chest reaching for the band behind your shoulder blades, closing the rib cage. And then from here, we'll bounce 4 times with our knees soft, and then we'll go forward for 4 on our dominant leg and back to 4, center, forward for 4 on the non-dominant leg, and back to center for 4. So we're going to keep this pattern, 4 center, 4 on the dominant leg going forward and back, 4 center, 4 on the non-dominant leg going forward and back. Watch out for looking down, keep your head up on your spine, ample distance between that chin and chest, collarbone wide, roll those shoulders down the back. Remember, the chest is reaching for that band behind your shoulder blades. Belly is pulling in towards the spine. Let's set this band down and learn our final exercise. We'll need our lightest Theraband. You're going to hold it and pull the arms into a T position here. And in this T position, we'll keep the arms isometrically held with a micro bend in the elbows, making sure that the arms are in your peripheral vision and they're not too far behind you. We'll be going side to side in the frontal plane, keeping the legs hip distance apart, working those outer thighs and the outer edges of the feet to combat the pronation and knock-knee position that lordosis skeletally has structurally. So we'll go from side to side, 4 center, 4 on your dominant leg side to side, 4 center, 4 on your non-dominant leg side to side, and then 4 center. Keep this going. Breathing. Hear your breath. Collarbone is wide, abdomen is pulled in towards the spine. Your chest is reaching towards your shoulder blades through the body to close the rib cage. The head is up on the spine. Roll those shoulders back. Keep those knees soft. Going side to side, try to keep the legs still hip distance apart, pulling out on that band. Okay, let's set up for our first exercise. Remind you of that, the transverse plane. We have our lightest band. We're holding the serratus anterior hold, those 2 right angles. And we're doing 4 center, 4 on our dominant leg, 4 turning, 4 back, and then back to 4 with both legs, and then repeating the whole series on the non-dominant side. So there's 4 center on the non-dominant leg, 4 turning, and then 4 to turn back. Counting you in. 3, 2, 1. Give me 100% effort. First burst in the transverse plane, level 2 trampoline. Trampoline work is excellent for your lymphatic system. It's highly recommended if you are suffering from cancer. So if you have any friends or family that are suffering, please refer them to YouniquelyFit. This is an excellent way for them to take care of themselves and to do endurance training that will benefit them during cancer treatments. As you're working here, be mindful of the knee traction. Be mindful of the legs staying hip distance apart, pulling out on that band. It's there to help you. Try to not look down, jeopardizing your neck position. Keep your focus up eye level. Remember, ample distance between the chin and the chest. If the arms get tired, you can take them down for a second and then bring them back up. It is a full minute, so you're giving it all you got. Counting you down, 3, 2, 1. Take your recovery. Anything that needs to be stretched here, stretch. You can take all the bands off. I'll give you 20 seconds notice to get everything back on and get set up. If you need to stretch, get water. Just don't sit down. Please don't sit down. We're conditioning your heart. You're here for endurance work, burning fat, creating long, lean muscles, and working from the inside out by thinking about the transverse abdominis, that deepest layer of the core, staying involved in your work. So pulling the navel in and lifting in and up on those muscles that stop your stream of pee. Go ahead and begin putting the bands back on, getting set up. You have about 15 seconds now. Make sure you don't do any strenuous work during your breaks. You allow yourself to recover so the quality will be there when we start again. Counting you in. 3, 2, 1. Give me 100% effort here in the transverse plane. Last set. The serratus anterior hold is very challenging. I want to encourage you to keep renegotiating with the body. You're going to have, as you widen the collarbone, the shoulders may come forward. I want you to plug them down the back. Keep the elbows as high as the shoulders. This may cause them to round. You got to keep plugging them back and lifting the elbows up against that. The wrists are going to want to break. Keep them nice and flat. We don't want this to become a wrist exercise. Make sure that focus stays up eye level. Inhale laterally, pull the abdomen in, lift in and up on those muscles that stop your stream of pee, and hear those exhales. You're doing excellent work. Give me 100% effort, only 10 more seconds here in this transverse plane, the turning plane, 4 center, 4 on either the dominant or non-dominant leg to turn, and 4 back. Counting you down. 3, 2, 1. Take your break. So I'm going to remind you of your next exercise, but please don't do it. We'll have our second to heaviest band around our shoulder blades, under the armpits, serve the platter arms. We'll be moving forward and back in the sagittal plane, 4 center, 4 on the dominant leg, forward and back, 4 center, 4 on the non-dominant leg, forward and back. So now that you've been reminded, take your break still. I'm going to let you know when you have 20 seconds so you can set up. Okay, 20-second mark. Go ahead and get your upper body set up with the band. Standing on the trampoline, getting ready for the 100% effort. First set in our sagittal plane here. Counting you in. 3, 2, 1. 100% effort. Give it all you got. This is such a great way to exercise. Really fun, playful, enjoy bouncing. Gravity's helping you here. Just make sure those knees remain soft. And as you go forward and back, you're keeping the legs hip distance apart. I like to think about the counter tension between the legs, so one knee reaching back as one knee reaches forward. The opposition helps stabilize me. Play around with feeling this as you're working. Keep the range of motion small, just for safety purposes. Feel the outer edge of the feet working. Those lateral intrinsic muscles that are weak, we want to combat that pronation, improving your posture and alleviating any discomfort in those knees. Counting you down. 3, 2, 1. Take your break. So we have a minute here, and then we're going to repeat this exercise in the sagittal plane. So any stretch you need, maybe it's the front of the chest, the pec major, or maybe it's the bicep or the front of the shoulder, the anterior delt. Take a wall stretch. Maybe the calves need a little release. Take a nice gastrocnemius calf stretch using the wall. Do whatever you need to do to set yourself up for success for the next burst. You want to be able to give it all you've got. All right, we're at the 40-second mark, so let's gather our equipment so that we can set up for our final set in the sagittal plane. Remembering we've got the serve the platter arms, the soft bend in the knees. We're going to be going forward and back on single leg after we do our 4 center. Counting you in. 3, 2, 1. Give me 100% effort. Enjoy this cardio burst on the trampoline. There's nothing better than jumping, soaring through space. But remember, we're not making it about height right now. We're trying to build up the strength in those weak glutes and hamstrings, the abductors of the legs, staying really aware of the knee traction, staying soft, keeping the chest reaching for the shoulder blades, the collarbone wide, the head up on the spine. Focus of the eyes is up a little higher than eye level. This can be great for the back of the neck. Otherwise, we get strain in the neck if we look up too high, or we're looking down or turning or tilting the head. So the head position is very important as well. Relax your facial muscles. Counting you down. 3, 2, 1. Take your break. While you're taking your break, I'd like to remind you of our final exercise, traveling side to side in the frontal plane. We have our lightest Theraband in our hands. We're pulling out on it, creating a T. And from there, we're doing 4 bounces, then 4 on our dominant leg side to side. Remember, keep the range of motion small. And then 4 center and 4 on our non-dominant leg side to side. Make sure the feet are nice and parallel. There's a tendency to turn out, and this can bother the knees. So work in a parallel position. I'll let you know when we're at that 40-second mark. We're almost there. And here we are. We've got 20 seconds before we begin, so go ahead and set up, stepping up on the trampoline, keeping a soft bend in the knees, finding that T position, knowing where that is with the soft bend in the elbows, the wrist flat, the arms within your peripheral vision. Make sure they don't float behind. You're not hyperextending the elbows. Counting you in. 3, 2, 1 for center, 4 side to side on the dominant leg, 4 center, 4 side to side on the non-dominant leg. So keep this going. Think about the quality of the movement here. Breathing. You're doing excellent work. Hear your exhales. Inhale to prepare. So make sure you're breathing. You can do lateral breathing or belly breathing if it feels better. I like to do lateral breathing with that lift of the TVA, the internal lift of the muscles that stop your stream of pee to keep my back safe since we are bouncing. As you're working, keep the elbows soft, wrist flat, head up on the spine, apple distance between the chin and the chest. Keep the legs hip distance apart. Feel the outer edges of the feet working, counting you down. 3, 2, 1. Final break before our final burst in the frontal plane side to side. You've done excellent work. Take any stretch you need right now. Just don't sit down. Grab some water. Stretch the calves, the pecs, the front of the shoulder, maybe the quads, maybe the glutes. Anything that needs stretching, now's your time. Make sure you're breathing as you're stretching, sending oxygen to the muscles to relax them. Never lock the knees out. Keep them soft wherever you are. Retraining the body to work more efficiently. Okay, we've got 20 seconds before we begin our final burst. Go ahead and get set up. Coming up onto the trampoline with a soft bend in the elbows. Arms in your peripheral vision, wrist flat. Knees soft, abs in, head up on the spine. Counting you in 3, 2, 1. Here we go. Final burst here. Level 2 trampoline work. Excellent for the lymphatic system, for boosting your endurance, relieving stress and anxiety, sweating out those toxins, losing weight. So many benefits here. This is a great form of exercise for all ages because of how low impact it is using the trampoline. You only have 30 seconds to go. Give it all you got. You should be doing 4 center, 4 side to side on the dominant leg, 4 center, 4 side to side on your non-dominant leg. So notice our 4 center is a nice way to reset. It is a reset. You're doing great. Give it all you got. Come on, you're almost there. Hang in there. Push through it. I'm going to count you down. 3, 2, 1. Great job. We're going to move into flexibility work. Coming over to the wall, into a wall pec major stretch. Stretching your dominant arm out into a T, keeping a soft bend in the elbow as to not pull on the ligaments, but stretch the muscles. We'll twist away. Retract our chin here, exhaling the air out. Again, inhale laterally. Brace the abs. Retract the chin, exhale, and twisting a little deeper. Again, inhale, brace the abs. Retract the chin, exhale to twist. Doing great work. Inhale, prepare, brace the abs. Exhale, twist. Move your arm into a W or V position. If you took the full class, do the variation you did not do against the wall or on the floor, lying supine on the roller. And we're still twisting away from the arm, retracting our chin to engage our neck flexors. Knees are soft, twisting. One more breath here. And let's move to the other side for our pec major stretch with the arm stretched in a T, soft bend in the elbow. As you twist away with the legs together or hip distance apart if you have back issues, retract your chin so it moves back and you tuck it under on each exhale as you twist deeper. Inhale laterally, pull the belly in towards the spine, lift up on the muscles that stop your stream of pee, fog a mirror. Hear your exhale like you're fogging a mirror like Darth Vader as you twist. Inhale into the side body, brace the abs. Exhale to twist, moving the arm into a V or W position on the wall, changing the stretch to either the pec minor if it's in the W or the anterior delta bicep if it's in the V. And same thing, retract the chin as you twist, opening up the back of the neck, side of the neck, recruiting the front of the neck, soft bend in the elbow if you're in the V position as you twist. We're going to now turn and face the wall, feet hip distance apart. Step your dominant leg back first. Deep bend in the front knee, tracking over the second and third metatarsal. Pull the abs in, neutral pelvis, focus up eye level. Driving that back heel down as the pelvis pulls forward. Abs engaged. Holding it here. Inhale and exhale, step that leg forward, stepping the opposite leg back. Nice and parallel with that leg. Deep bend in the front knee, tracking over the second and third metatarsal. Reach the chest back towards the shoulder blades. Retract your chin. Keep your focus up eye level. Drive the heel down as the pelvis drives forward. Inhale. Brace the abs. Hear your exhales. We're releasing the gastrocnemius on each side. That outer calf muscle. One more breath. Exhale. Let's go ahead and grab a chair. We're going to set up for a supported lunge chair, hip flexor, psoas stretch. Start with your dominant leg behind you. This will be the harder side. Front foot should be completely grounded on the floor, outer and inner edge. So if it's dangling in the air, put a block under it or a book. And then from here, take the outside arm up, squeezing the quadricep of the back leg, trying to straighten it. Notice all 5 metatarsals are down. You don't have the whole foot down or the heel or arch, just the toes. And we're side bending away. Try to relax the chest back towards the shoulder blades. Plug the shoulders down the back. Keep your chin retracted here. This is a deep, deep stretch. Very challenging postural stretch. I'd encourage you to be here for a full minute. This is going to really change your movement patterns once we open up those overactive hip flexors, allowing you access to your core to flatten your stomach and deepening the work in your butt muscles and hamstrings to give you longer legs and a tighter tush. All right, you're doing great. Inhale laterally. Watch out for the ribs spraying forward. Pull the belly in. Exhale to side bend deeper, squeezing the front of the thigh. Equal weight in both feet, or metatarsals rather. Go ahead and exhale to switch sides, setting up on your second side. Make sure that front foot's fully connected. So are the back metatarsals. Outside arm is up, shoulders are down, chin is retracted. You're going into lateral flexion towards your chair. Watch out for overextending the low back. Just keep the belly in towards the spine and lift up on those muscles that stop your stream of pee. This is going to help tremendously with the back issues, if you have them, by conditioning your transverse abdominis. As you inhale, hear those exhales like Darth Vader. What's happening in your rib cage? Reach the chest back towards the shoulder blades. Make sure that front knee is tracking over the second and third metatarsal. The toes beside the big toe. We consider the big toe the first metatarsal. All right, from here we're going to slowly come out of that. Set the chair to the side, coming back to center. Take a hold of your roller, and you're going to stand in a lunge, putting your back knee down to come down safely. If you have back issues, brace your abs. We're going to roll out our quadriceps, bring our forearms onto the ground, and walking forward and back, keeping the abs tight, neutral pelvis, getting deep into the fascia of the quads. You can play around with external rotation of the legs and parallel legs, finding any spot that needs your attention and holding it there. The quadriceps are an overactive posturally tight area, so we're going to be here for a full minute. Feel free to just hold the position and really put your body weight and pressure into it if there's a spot that needs attention. You can roll back and forth, engaging the abs, working the back as you walk in this plank. If you're not finding spots, I'd encourage you to externally rotate the legs, getting deeper into the groin area where the hip flexors are. That's definitely going to be tight if you have lordosis or kyphotic lordotic posture. One more breath here. Inhale laterally, pull the abs in, lift up on those muscles that stop your stream of pee. Exhale, sustain that lift, coming off the roller. We're going to now bring our dominant leg. We're going to roll our posterior tibialis, which is medially near the knee, down the tibia bone. You can stay up by the knee, that's usually the sweet spot, or you can roll about halfway down along the tibia bone into that fascia. You can always lift the hips up, pressing into the other leg or into your arm, however you leverage it, to intensify the stretch or the release of the fascia. Do what feels best for you. This is an intense exercise for people that have knee tracking issues. Any alignment issues can cause, especially the pronation. So as you're doing, your sumo squats and lunges and learning to track the knee over the second and third metatarsal, if the knee tracks poorly, not rolling this out can result in knee discomfort. So we really do want to think about the posterior tibialis and the other spot we're going to get in a second as areas to reset our knees when we are learning better movement patterns and conditioning the weak muscles in our body. So before we go to the other side, we're going to take the roller now above the knee immediately. This is a great area to get into because it releases the femur bone back down. So anytime you do cardio or even walking, no matter how high or low impact it is, especially if it's high impact, if you're jumping, you want to reset your femur bone so it's not hiked up and pulling on the back. So as you roll in, I encourage you to play around with internal, external, internal, parallel positioning of that inner thigh area right near the knee to get that sweet spot to release the femur bone down. You can always intensify it by pressing heavier into the roller. And once you've had one more breath, we're going to slowly make our way to the posterior tibialis rolling on the other side. Remembering that's medially along the tibia bone. I find that the sweet spot's near my knee. Play around with the rotation of the leg. If it's internally or externally rotated, wherever you feel more tenderness, that's where you want to be. Push yourself to really stay for this full minute. This is going to really change your range of motion and your movement patterns. It's the combination of strength training, cardio training, and flexibility and balance work that's going to allow you better functional movement and enhance sports performance, as well as prevent injuries. So as you're working here, be mindful of holding the breath. When things hurt, we hold our breath, but try to not do that. Send oxygen to these muscles, allowing them to relax and release. Brace your abs. We're going to reset the position above the knee now immediately, getting into our posterior tibialis. As you're rolling above that knee, play around with the positioning. I often find people really, the first couple times they do this, have trouble finding the tender spot. So encourage yourself to explore movement in the leg from the hip socket, internal, external, right by the knee, getting into that fascia. It's really important if you have back issues that you release this area and reset the femur bone so it's not pulling on your low back. Couple more breaths, keeping the chest reaching for the back body, trying not to collapse into the side of the body or the arm that's down, keeping your chin retracted, using the front of the neck. Last breath, brace the abs. From here, we're going to come slowly over to the wall, bringing our legs up the wall. With the legs up the wall, I want you to find a neutral pelvis if you have back issues and tuck the pelvis if you don't. Subtle external rotation to open the legs out to the side with relaxed feet. Once the legs are open, let's externally rotate from the ankle joint, doing circles with our right foot for 10 and 9, away from the body, 8, 7, 6, 5, 4, 3, 2, 1, and reverse the circles. Actually, no, let's do the same circles, eversion, away from the body on the other side for 10, 9, 8, 7. As you're doing them, try to imprint the back ribs, retract your chin, check in with your pelvis. Is it in the proper position? Neutral if you have back issues, tucked if you don't. Finish your last circle. Slowly bring the legs together and make your way off the wall, coming into a comfortable seated position, using the abs to sit up tall, pulling them in towards the spine. Great work.